Welcome to the Sykes and Company PA video blog. I'm here with Ollin Sykes, and today we're going to talk about a couple of gross margin expansion ideas. Good morning, Ollin.
Morning, Rachel. How are you today?
I'm great. How are you?
Very good, very good.
Excellent. So I hear you have some ideas about gross margin expansion for independent pharmacists. What are they?
Yeah, actually, one item, and I'm kind of starting in reverse here, that I learned just within the last few weeks that in the Obamacare provisions, there is a provision that obesity consulting has a very liberal reimbursement rate for the first 6 months in particular, for patients that have BMIs, I want to say in excess of 30. And my understanding from an exhibitor that actually was sitting next to us at a recent regional trade show that was frankly touting this program, and he was a pharmacist, and he has a particular program that he touts around this, is that there's a reimbursement rate of some $1,600 for the consulting with obesity patients that can be done inside these pharmacies when you meet certain basic requirements to do this consulting for the reimbursement rate. But that is an example. It's just essentially an example of taking patients that are already coming in your pharmacy that are probably already on a significant number of meds, most likely type 2, diabetes medications, and probably others, blood pressure, etc., and adding value to your pharmacy and to, more importantly, your gross margin, and more importantly to the patient by advising them in this rapid obesity problem we have in this country. And I can speak to that directly, quite frankly, because I've lost 75 pounds in the last 12 months. So I know what I went through once in my life, making that decision of really dealing with obesity and how to go about both the exercise and diet process. And it kind of comes close to home with me. But with pharmacy margins being tighter and tighter with reimbursement rates as they are, then the more kinds of outside ideas, like is in this Obamacare provision for obesity counseling, that's just a sample. That what they have to do now to increase their gross margins going forward. And I'm in the process of getting more information about that later. Perhaps we can have a whole separate section on this at a later time. But I did want to mention that because I was really pleasantly had my eyes opened. In course, these are the kinds of things we openly share, and I have already started to share this information with a number of pharmacists already that had no clue this was in the Obamacare provisions, as did I. I've just learned this in the last 2 weeks. A second item we're seeing that kind of comes more close to home for many pharmacists are when we were reviewing monthly script audit logs. And if you're having to ask yourself and listening to this, what is a monthly script audit log? God bless you. It is a report that comes out of your script processing system, both daily, you can run it daily, weekly, and month end, that we use to determine how pharmacies are progressing with respect to their margins, their margin dollars, be it from generics and brands, and on an aggregate basis, on a total basis. And what we're seeing in these script audit logs is that those pharmacies that are pushing generic fills and making sure they touch base with the prescribers in their area, their immediate area that they're serving, to take patients off of brands and move them into generics, the more profitable they become in terms of gross margin dollars and in terms of gross margin percent. Now, obviously, coming off of brands into generics, their revenue on an aggregate basis drops. But this game is not about gross revenue dollars. It's about gross revenue margin dollars and percent. And quite frankly, we've got many pharmacies that are now generically filling 90% and over of their scripts. And frankly, if you're under 80%, you've got some serious issues the way I'm looking at it, because with brands, as you know, you're getting 6 to 8% margin dollars on brands. The margin dollars there are all going to the Pfizers of the world, and you have really no control over that. But you're getting, in many cases, 45 to 60% gross margin on generics that you're filling. And the more scripts that you fill the generic, the better off you are. So you got to really push hard at that. And I hear so many pharmacists saying, well, I don't have time to call that doctor to say, hey, I have available generics for this particular medicine that's come out on brand. You have to take the time to do it because it means a lot to you in terms of gross margin dollars and profitability for your pharmacy. And so these are just two ideas that I think are tremendous in helping you increase your gross margin dollars, both in percent as well as dollars on an aggregate basis. And just the kinds of things that we continue to try to inform our pharmacy clients on a repeated basis as we go through and looking at their numbers and their financial statements each month.
That's great, Ollin. Thanks for sharing all that info with us, and we'll definitely look for an update on the obesity prevention. That'll be exciting to hear in the future.
Be glad to do that, and I'm sure we'll be talking about that much more.
All right, great. Thank you.
Thank you, Rachel.